Now, with concerns mounting over a post-holiday surge in COVID-19 infections ahead of another three-day holiday, which begins today, South Korean health authorities announced 2,176 new COVID-19 infections today. All but 31 of them were locally transmitted. For more on this, we are joined by Choi Won-jong here in the studio. Welcome, Won-jong.
Good afternoon.
Let's start with today's figures.
Sure. Less than an hour ago, health officials announced. So you already said the figures, but less than an hour ago, health officials announced several prevention guidelines for the upcoming three-day weekend. Now, several things that I'd like to mention from the briefing. First things first, the authorities have predicted many will travel this weekend, so they urge the public to take short-distance trips rather than long-distance trips with larger groups of people, if possible. They also set a prevention period of 5 weeks for fall travel between October 9th and November 4th. Now, when traveling on the public transportation like a bus, wearing a mask is a must. If you're in national parks, the authorities also ask business to have a one-way walking policy, have fewer people in the cable cars, and also cancel inside education programs at the parks. They're also ramping up the COVID-19 testing centers, and 14 of the temporary testing sites at the expressway rest areas will operate for longer hours, as well as testing centers at the 10 major tourism spots. Also, this morning they said the country will expand at-home COVID-19 care across the 17 cities and the provinces, and in preparation for a gradual transition back to normal. It's because the authorities have seen a decrease in both severe cases and the fatality rate.
Now let's turn to the vaccination campaign here in South Korea. I heard that pregnant women are next in line to reserve their shots. They start today, right?
That's right. So starting today, Friday, here around 136,000 pregnant women in Korea will now be able to book their slots. Bookings can be made through the KDCA website, where individuals are required to input information about their pregnancy. Now, the actual vaccination will kick off on October 18th, less than 2 weeks from now. They will be getting either Pfizer or Moderna vaccine. And as you know, that this has been a very sensitive issue to talk about due to the risk of possible side effects. But the health authorities have continued to urge pregnant women to get a jab if possible.
Now, Won-jong, the World Health Organization said that they hope to vaccinate 70% of the global population by middle of next year. Can you tell us more on that? So
it appears to me that the WHO is seeking a global cooperation between the pharmaceutical companies and also the countries with the high vaccination rate. The WHO said Thursday that they have set out the plans to achieve a worldwide vaccination, stressing the targets at 40% of the population of all countries by the end of this year, and 70% by the mid-2022. The organization also mentioned their fair vaccine distribution is key, meeting the goal and eventually seeing the end of a long COVID-19.
But what about here in South Korea? When will we be able to see 70% of the population get fully vaccinated?
So, Morgan, that's a very good question. So yesterday, the South Korea's top health official, Chung Eun-kyung, said they're expecting to see a 70% of a full vaccination rate by at least October 25th. So if that happens, health authorities are planning to begin to make the gradual transition to so-called living with COVID strategy, possibly easing some restriction after November 9th. So what's really interesting is that this is actually the first time the authorities have ever mentioned a start date. And my concern is that the goalpost might shift if infection rates keep rising after November 9th date. That's why for a stable transition, the health authorities are trying to come up with the more adequate ways to treat COVID patients at home, as well as improve the current medical system, mostly targeting severe ill patients. Now, the availability of treatments will be a factor. They're currently in discussion with the drug makers to secure as many oral treatments as possible.
Now, Won-jong, thank you so much for your efforts this week.
No problem.
We hope to see you again in the next few weeks, right?
Yeah, that's right.
Thank you again.